what is ADHD? It's a neurodevelopmental condition. I don't like to use the word disorder, but it has a higher diagnostic rate in males than females. In fact, it's 4-to-1. More likely to be diagnosed in males. And this is because boys tend to display more overt features with greater emphasis on their hyperactivity and the impulsivity side of ADHD, where girls tend to be more of the head in the cloud, kind of daydreamer, inattentive subtype. So there are 3 recognized subtypes. Symptoms do begin in childhood, sometimes as young as 2 and 3, 4 years of age. I myself noticed my own son around the age of 3 that he was noticeably more, hyperactive than some of his peers, certainly present by the age of 12. And to receive a diagnosis, symptoms must be present across 2 situation contexts, and that is both at home and at school. So some of the characteristic behaviours include, as I've already mentioned, age inappropriate behavior, marked hyperactivity, very kind of restless, fidgety, squirming behavior, losing interest in assignments, tasks like homework, schoolwork very quickly, struggle to follow instructions, have this inability to think before acting. They will act first, think later, and often be very remorseful afterwards. But that puts them on the receiving end of kind of repetitive negative feedback from parents and teachers, which can, affect their self-esteem and so on. If they're constantly in trouble, it's also going to affect their academic performance. Okay, the inattentive subtype, very easily distracted, prone to kind of wandering off, frequently losing items, really struggling to complete schoolwork. And this kind of general absent-minded behavior can create utter chaos in the young person's life. So emotional dysregulation is a side of ADHD that's not commonly researched and not really discussed as much as it should be. But what it describes is just really sullen mood and irritability. So unprovoked emotional outbursts, which can result in rage, and obviously triggers are not easily noticeable. So this can come very rapidly. A lot of neuroimaging work in this area has been done by Dr. Philip Shaw at the NIH, ex-King's College London, like me, and he has reported dysfunction in the striato-amygdalo-medial prefrontal cortical network, and that network can give rise to rapid shifts in emotional responses, and specifically reactive aggression. They are triggered to reactive behaviours way more than neurotypicals, and the brain's frontal cortex plays a role in this. So if you think of the frontal cortex, which is engaged in forward thinking, what we call higher order executive functionings, planning ahead, decision making, some aspects of emotion, it basically helps people think before they act. It's almost like the cognitive brakes, you could think of it metaphorically, compared to more primitive regions of the brain, such as the limbic system, which can act as an accelerator. So there's this kind of like cognitive dissonance between the limbic system, which is the part of the brain that's saying, take this risk, or try this, or wouldn't this be fun? So like novel seeking, sensation seeking, risk taking, impulsive behaviors. And then the frontal cortex, which is saying, think about this, and trying to rein in those very impulsive urges and desires. We also know that children with ADHD have impaired reward-related responses, which is also linked to motivational deficit. So in other words, children with ADHD want immediate rewards. They'd rather choose a smaller immediate one than a larger delayed one. And that's why behavioral incentives which are delayed seldom work in these children and adults. Okay, just some ADHD myths for you. Really important to say that ADHD is not unique to children raised by single parents, nor those from low economic status. It's not caused by watching too much television. It does not equate to lower intelligence. In fact, it's linked to, creativity and many gifts. I've witnessed that myself over and over. It's not just a label for naughty children, and it is not an invention of the pharmaceutical industry. Very important to add.